Something as simple as the words we use or the beliefs we have can make a world of difference for those struggling with substance use disorders. Hi, I'm Dr. Andrew Smith, psychiatrist at the Ottawa Hospital, assistant professor in the Faculty of Medicine at the University of Ottawa, and a clinician investigator in the neuroscience program at the Ottawa Hospital Research Institute. In this video, we'll delve into three key areas: how language and attitudes shape stigma, how stigma can delay crucial treatment, and the broader effects that it has on our healthcare system and society. Let's unpack how breaking down stigma can make a real difference for those living with substance use disorder. How we talk about substance use disorders and the words we choose can have a huge impact on how we see and treat those affected by it. Language is one of the most powerful tools shaping how society views substance use disorders. Terms like junkie, user, or even addict dehumanize individuals and imply that they are responsible for their condition. This reinforces stigma and makes those with substance use disorder less likely to seek help, fearing judgment or labels. However, stigma isn't just about the words we use. It's about the beliefs behind them. Without compassion, even neutral or clinical terminology can carry judgment, making those with substance use disorders feel isolated. Stigma is not just about language. It's about approaching substance use disorders with empathy and understanding, recognizing that it's a medical condition that requires care and not blame. The shift from using terms like addiction and substance abuse to substance use disorder is part of an effort to move the conversation from a moral failing to medical treatment, helping both the public and healthcare professionals respond to substance use disorders more compassionately. Now that we've explored how language and beliefs contribute to stigma, let's look at how this stigma directly affects treatment. Unfortunately for many people, stigma creates barriers that delay crucial help. For many, the fear of judgment by healthcare professionals is particularly strong, creating an additional barrier to seeking care. This fear of being labeled or judged leads many to delay treatment until their health deteriorates significantly. Without early intervention, individuals are more likely to experience complications like overdose, untreated infections, or comorbid mental health issues. These make recovery more difficult and increase long-term health risks. Early support not only improves outcomes, but also reduces healthcare costs, as timely interventions are far more effective and cost-efficient than waiting for emergency care. When healthcare settings feel unwelcoming, people with substance use disorder may be reluctant to return for treatment. This can perpetuate a cycle of neglect and makes recovery more challenging. Reducing stigma within the healthcare system is crucial for encouraging timely and supportive care. Finally, let's talk about the bigger picture, the ripple effects of stigma on our healthcare system and on society as a whole. The impact of stigma extends far beyond individuals. It affects the entire healthcare system and society. When stigma prevents people from seeking early intervention, the consequences are felt not just by those struggling with the disorder, but also in the form of increased healthcare costs and societal burdens. In Canada, substance use disorder cost the healthcare system $13.4 billion in 2020 alone, including emergency services, hospitalizations, and physician care. These high costs are often preventable with earlier, more compassionate treatment. But stigma keeps people from accessing care until their condition becomes critical. However, the ripple effect of stigma isn't just about financial costs. Stigma leads to preventable deaths, untreated infections, and worsening health conditions that could have been mitigated by timely care. The societal impact includes lost productivity, strain on social services, and the emotional toll on families and their communities. By reducing stigma and providing compassionate care, we not only lessen the burden on our healthcare system, but more importantly, we can save lives. Creating supportive environments can help individuals access the help they need before they reach a crisis. Stigma isn't just a barrier to treatment. It makes recovery harder and burdens society. Changing how we talk about substance use disorder is the first step to breaking down the stigma. By doing so, we can save lives, lower healthcare costs, and create a more compassionate society. Whether through non-judgmental support, raising awareness, or encouraging early interventions, every action can help to make recovery possible for all. Thank you for watching.